Hello everyone. In this video, I'd like to talk about nasal breathing and gut health. And I imagine some of you are thinking, what in the world does nasal breathing have to do with gut health? Well, I'm very glad you asked that question. I first dug into nasal breathing when I read this book, The Oxygen Advantage by Patrick McKeown, and I found many benefits that I'll start to delineate here. But first, a disclaimer. Just want to mention that anything I share here should not be construed as medical advice. That I am just expressing my experiences, my opinions, although I think you'll see that there's a whole lot of science backing it up as well. I practice 100% nose breathing unless I'm eating or drinking or talking. And I may have been doing that before I read this book, but I'm a lot more aware of it now. I'm mindful that whether I'm breathing through my nose, through my mouth. So I try to make sure it's 100% nose breathing unless I have to have my mouth open for those certain activities. One major change I did make is that now I nose breathe during all my exercising and been able to run up to 5 miles exclusively breathing through my nose. Now, this took some practice. The first time I tried it, I live in Wisconsin, and I was indoor on a treadmill in the winter. And the first time I tried to exclusively breathe through my nose while running, I only got 7 or 8 minutes, I believe. And but I progressed quite rapidly. The next day, I added several more minutes after that, and it was just within a month I was up to 30 minutes or so. No problem, but definitely needed to develop that. And I've run up to 5 miles. I don't usually run that far, but I was able to run only nose breathing. Now, when I nose breathe, when I breathe in my mouth, I can run at a quicker pace. That would be more of a race pace if I'm in a 5K or something. But I lower my pace by about a minute per mile when I nose breathe. And theoretically, if I wanted to run longer, I think I could do 10 miles or even a marathon by breathing through your nose as you just build up to that. One thing I do is I tape my mouth at night to prevent mouth breathing. And some of you might have heard of this before. It's gaining in some popularity. Now, I just use medical tape. It's the cheapest and easiest, in my opinion. But they do make these medical tapes, mouth tapes, that some of them have an X in the shape of an X, so you can still breathe out of the corners of your mouth if that helps give you a little more confidence. Some cover the lips and have a little hole in the middle, so you can always breathe through your mouth if you want to. And if I have, bad head cold, I just don't tape my mouth because I'm not breathing through my nose as effectively. But I found that to be very advantageous. And I occasionally practice breath hold exercises in this book, and I found them to be beneficial as well. What I want to do is talk about the long-term problems from mouth breathing. Many of these, and my daughter-in-law is a dental hygienist, and she can testify to these. All sorts of dental orthodontic problems, gum disease, oral and facial structural issues. Now, I don't want to alarm you, but this can happen. Not that it will happen, but if you have a chronic mouth breather from early childhood, you have a much higher potential to develop these oral and facial structures. And if you just Google mouth breathing and oral facial structural issues, you will find some very striking photographs of now young adults and adults where their jaw is jutted in severely. You look at it from a profile, and it's not just a cosmetic issue, but it's a long-term health issue as well. So that can definitely happen. Jaw disorders like TMJ. Another benefit is that if you breathe through your mouth, you have a poor oxygen delivery to tissues, which results in long-term inflammation. And we understand in the gut health arena and in health in general, of course, what you want to avoid at all costs is inflammation. What happens with nasal breathing is something called the Bohr effect, which is simply just a pressure differential between the tissues and the blood oxygen levels. And your body actually requires carbon dioxide in order to release that oxygen from the hemoglobin into the tissues. And we think about it, if you hold your breath, what's happening is not just a reduction in oxygen, but an increase in carbon dioxide. And that's the very thing that causes your brain to finally tell you to take a breath. Well, again, without carbon dioxide, you could not release oxygen from hemoglobin into the tissue. So that increases that efficiency. And then if you compare carbon dioxide versus oxygen saturation, Many of us are familiar with that, the little device that fits on your index finger and tells you the amount of oxygen in your blood. Just because you have a high level of oxygen saturation, you get a 99% O2 sat and not have an efficient delivery of oxygen into your tissues. And like I said, I can run up to 5 miles by only breathing through my nose. So you can only imagine that my body has adapted somehow to that. Ultimately, a reduction in the amount of oxygen that I'm bringing in. Therefore, it only stands to reason that the efficiency of delivering oxygen to my tissues has increased as a result. One benefit I've definitely noticed is um, a, removal of my asthma symptoms, and uh, I'll talk about that in regards to gut health as well in just a moment. But in the book Oxygen Advantage, he has something he calls a BOLT score, body oxygen level test. And you do this very simply. You breathe in and out normal breaths a couple of times, and then you breathe out normally. You don't force the exhale, you just breathe out normally. And as soon as your breath is expired, you begin a timer, a stopwatch, and you stop that timer when you need to take a breath again. And when I first did this, I only got 16 seconds. So essentially, understand you're holding your breath when you have no breath in your lungs. So it is a bit of a challenge, but 16 seconds is not very good. And through all of my, especially I believe, exercising through nasal breathing, I've been able to double that BOLT score. And I've been up into the low 40s at times, but I tend to average in about the mid 30s. So that is one way to go and test yourself. And you will definitely, even if you start at 30 something, you will definitely improve your BOLT score through nasal breathing. And you also get poor sleep quality and sleep disturbances. And this was my wife's greatest noticeable benefit from taping her mouth. I was able to somehow talk her into trying this. And her pattern used to be, and she didn't realize that she was breathing through her mouth so much while she slept. And the result was she got a very dry mouth, and she had to wake up very often. It would wake her up and drink water that she kept next to her bedside. But once she tapes her mouth now, that has gone away. So she sleeps a lot better. That's just one of the benefits. Other benefits from nasal breathing is you trap dust, germs, other pollutants from entering the respiratory system, which of course is what your nasal passages were designed for, with the mucus and the nasal hairs. And you do not get that benefit, of course, if you're breathing through your mouth. It just goes straight into your lungs. Keeps air moist and humidified before it enters your lungs. Special cells release nitric oxide, which is antiviral and antibacterial. And I'll be talking about that in a moment, specifically in regard to gut health. Helps dilate blood vessels and supports healthy blood pressure levels. Supports better oxygen deliverability, which I was just talking about. And it lowers respiratory rate, which can support better stress balance and relaxation. I've noticed this myself. I pray a lot, but I have never been one to get into a lot of breath work exercises for meditation, that sort of thing. But I have noticed that I can be a lot more relaxed if I'm sitting in a chair and just practicing a slower breathing, which is also detailed in the book, and that has helped a lot. Now, I detailed my asthma story in a prior video, the gut lung axis video. So I won't go into all the details here, but I was on various prebiotic fibers, added HMO, and as my bifidobacteria levels rose, I noticed my asthma improved significantly, 70, 80% better. But it wasn't until I was nose breathing that I found that my asthma essentially disappeared. And I believe it's through that nitric oxide benefit and the CO2 tolerance as well. But then, for reasons I won't detail here, my bifido crashed, and not surprisingly, my asthma returned. And what I did was added 4 grams. I was only now the only prebiotic fibers I was taking is 4 grams of HMO, and within a week, my asthma was gone. I was very happy about that, but I noticed on my next test that my bifido not only did not rise, but actually dropped a little bit further. So it was not the bifido that helped my asthma. And the only thing I could find in my results is this massive jump in Veillonella, which I also discovered after the fact can have an impact on asthma as well. So that's my best guess. But I want to note that obviously the gut bacteria I believe, is the biggest impact of my asthma, but the nasal breathing also had quite a significant impact. Now, specifically talking about nitric oxide and optimal digestion. This is from an article in Biosphere Nutrition. And for whatever reason, this article did not have scientific notations and footnotes, but it was very easy to find many research papers that backed up these 6 points. One, regulation of gastric acid secretion. Nitric oxide plays a crucial role in regulating the secretion of gastric acid in the stomach, which is essential for the proper breakdown and digestion of food. And many people have problems because they don't produce enough like hydrochloric acid, for example, and have problem breaking down their food. So nitric oxide is beneficial there. Control of intestinal smooth muscle relaxation. Nitric oxide is a potent relaxant of the smooth muscles lining the gastrointestinal tract. This relaxation allows for the proper movement and transit of food throughout the digestive system. We all understand that transit of food, motility is very important for gut health. Now, let me say that in regard to these 6 points that I'm mentioning on nitric oxide, I personally haven't noticed a difference in my own gut in regard to nasal breathing, but other than the other benefits that I already mentioned. But I, in a sense, trust the science on this one because there's such a vast supply of scientific data, and I liken it to, for example, vitamin D3 levels. Before I started taking a vitamin D3 supplement, I had very low vitamin D3 levels, and now I've got very healthy amounts. I didn't notice any difference in any symptoms or anything, but the science tells me that you really need to have levels 40, 50 or above. So beneficial. So I just trust the science in regard to what nitric oxide, increased nitric oxide, is doing for my gut. Number three, protection of gastrointestinal mucosa. By promoting the secretion of mucus and maintaining the integrity of the gastrointestinal mucosal barrier, nitric oxide helps protect the digestive system from damage and irritation. In other words, we're talking about leaky gut here and the tremendous damage that can result there. So, nitric oxide is just helping to eliminate or lessen the likelihood of a leaky gut. Four, inhibition of inflammatory responses. Nitric oxide has an anti-inflammatory property which that help in reducing inflammation within the gastrointestinal tract, which can lead to various digestive orders if left unchecked. Again, anything that is anti-inflammatory is going to be beneficial. Antimicrobial activity, and also, as mentioned prior, antiviral activity. Nitric oxide has antimicrobial properties, helping to defend the gastrointestinal tract from harmful pathogens that could disrupt digestion or cause infection. Now, don't think that nasal breathing is like popping an antibiotic. It's not that potent of an antimicrobial impact, but it has an ongoing, continual, low level impact, which can help protect you from pathogens. And then finally, interaction with other signaling molecules. Nitric oxide interacts with other signaling molecules involved in digestion, such as prostaglandins and vasoactive intestinal peptide, to ensure proper coordination and regulation of the digestive process. So, just an overall benefit there from nitric oxide. So, in summary, gut health is just one of the many benefits of nasal breathing, others I've mentioned. And like many things in life, the more you do it, the greater the benefits. And I commend you to consider reading the book Oxygen Advantage, considering the benefits to you of nasal breathing, and especially in regard to your gut health. Thanks so much for watching.